14 signs that you are vitamin D deficient. You might be deficient right now, seriously. As you watch this video, more than 1 billion people have insufficient vitamin D. 1 billion. Most of them have no idea. They blame stress. They blame aging. They blame a bad night's sleep. But the real culprit is hiding. It's been ignored for years. Here's what makes this deficiency so dangerous. It doesn't announce itself clearly. It spreads quietly across multiple systems: bones, muscles, mood, immunity, weight. It mimics dozens of other conditions. That's why it goes undiagnosed so long. That's why most people are shocked. They finally see their test results and everything makes sense. In this video, you'll learn the 14 most important signs. The first 10 are well known, but the last 4? Almost nobody connects them to vitamin D. Those are the ones that confuse doctors most. Those go undetected for years. Stay until the end. Sign number 13 surprises people the most. Everything here is based on scientific evidence. It was reviewed by qualified health professionals. This doesn't replace a doctor, but it might push you to finally schedule that appointment. Pay special attention to sign number 3. It's the one most people overlook for years, and it's the one most often blamed on everything else. Block 1. The signs. Your body is already sending. Sign 1. Weakened immune system. You get sick, again, and it takes forever to recover. Most people blame bad luck or the season or their kids, but there's something deeper happening. Vitamin D is at the center of it. When vitamin D drops, the immune system suffers. Vitamin D activates T lymphocytes. These cells identify and destroy invaders, viruses, bacteria. Without enough vitamin D, they stay dormant. They can't mobilize. They can't protect you efficiently. The result, you get sick more often. Colds drag on for weeks. Recovery from any infection slows down. There's also a detail most people miss. Older adults face an even greater risk. With aging, skin loses efficiency. It synthesizes less vitamin D from sunlight. This process begins around age 50. It accelerates after 70. A 70-year-old needs far more sun, more than a 25-year-old, to produce the same vitamin D amount. And most elderly people spend less time outdoors. So the deficiency sets in, silently, steadily. Getting sick frequently doesn't automatically mean deficiency, but if recovery takes weeks from a simple cold, while others bounce back in days, or if you catch every bug, that goes around, that pattern is worth investigating. Don't assume it's just your constitution. The next sign is frequently mistaken for PMS, stress, or anxiety. It affects far more people than most realize. Sign 2. Mood swings. Your mood shifts without warning, without reason. Irritability, emptiness, low motivation. Emotional swings that come and go. No clear trigger. Most people accept this as just how they feel, or they blame their circumstances. But there may be a biological explanation, one they've never considered and never tested for. Vitamin D is not just a nutrient, it acts as a steroid hormone, a master switch for over 200 genes. Among them are genes for serotonin, for dopamine, for other neurotransmitters. These are directly tied to mood and emotional well-being. When levels drop, that whole regulatory system goes with them. And unlike a bad day or a rough week, this kind of mood disruption doesn't resolve on its own. It persists. It deepens. It often continues for years, before anyone thinks to check a vitamin level. A 2024 meta-analysis examined 31 randomized controlled trials, nearly 24,000 participants. The conclusion was clear. Vitamin D3 supplementation reduced depressive symptoms significantly. Effects were most pronounced in people already showing depressive symptoms. At the start, there's also a specific condition tied directly to this. Seasonal affective disorder appears in winter, precisely when sun exposure decreases, and vitamin D hits its lowest point of the year. If your mood worsens consistently in winter, that's not a coincidence. That's biology. But the next sign is the most deceptive, because almost everyone has a different explanation for it. Sign 3. Chronic fatigue and low energy. You slept 8 hours. You wake up exhausted anyway. This isn't normal tiredness. It doesn't respond to rest. It persists no matter how much you sleep. It affects your body, your thinking, your ability to get through the day. Many people spend years believing it's stress, or modern life, or just aging. They cut back on commitments, they try sleeping earlier, they drink more coffee, nothing changes. It's often none of those things. The mechanism is direct. Vitamin D is essential for mitochondrial function. These are the structures inside cells that produce energy. When levels are low, cellular energy production drops. You feel it everywhere. Your body feels heavy. Your thinking feels foggy. Even simple tasks feel like an effort. And here's what makes this sign particularly insidious. Fatigue has so many possible causes. Vitamin D is almost never the first thing anyone investigates. Doctors check thyroid function, iron levels, sleep quality. Vitamin D often comes last, or not at all. Meanwhile, the person keeps struggling through every day, convinced something is simply wrong with them. If you're concerned about your energy and can't find a clear explanation, ask your doctor for a vitamin D test. It's a simple blood test, affordable, widely available, and it can completely change your understanding of what's happening in your body. Sign 4. Weakened bones. This one is the most well-known and the most misunderstood. Most people know vitamin D matters for bones, but most don't know why. And that gap leads to years of ignored warning signs. Vitamin D doesn't build bones directly. It's the key that allows your intestine to absorb calcium from food. Without enough vitamin D, calcium passes through. Your digestive system doesn't absorb it, and when circulating calcium drops too low, the body does something alarming. It pulls calcium from the bones themselves to keep the heart beating, the muscles contracting, the body functioning. Over time, bones become progressively more porous, more fragile. Diffuse bone pain appears, especially in the back, the hips, the legs. Fractures happen from impacts that should cause no harm. Diagnoses of osteopenia or osteoporosis arrive seemingly out of nowhere. In extreme cases, severe deficiency causes rickets in children and osteomalacia in adults, conditions where bones lose structural rigidity entirely. Here's something that makes this even more important. Bone loss is silent. You don't feel calcium leaving your bones. You don't feel them weakening. By the time a fracture happens, or a bone density scan reveals damage, the deficiency may have been working against you for years. That's why catching the signs early matters so much. One more thing worth noting. Vitamin D doesn't work alone. It needs calcium, magnesium, and vitamin K2. Vitamin K2 directs absorbed calcium to the bones and away from blood vessel walls. Supplementing vitamin D without these cofactors may absorb more calcium without putting it where it needs to go. If you've identified 2 or more of these first signs, pay even closer attention to what comes next. They reveal dimensions of this deficiency that go far beyond the bones. Sign 5. Dry skin and dermatological conditions. Your skin is dry, flaky, itchy, and nothing seems to fix it. Most people never connect this to vitamin D, but the connection is real, and it's backed by solid research. Vitamin D has specific receptors in skin cells. It plays a direct role in regulating hydration, cellular renewal, local inflammation. When levels drop, that regulation fails. The skin begins to show dryness, flaking, uneven texture, sometimes mistaken for dandruff or eczema, or just sensitive skin. Recent studies show a clear association. Vitamin D deficiency links to atopic eczema, to psoriasis, inflammatory skin diseases that are more prevalent in patients with low vitamin D. They're also more severe. There's also ichthyosis, a less-known genetic disorder. It causes extremely dry and scaly skin. Its severity is partly tied to vitamin D levels. If you've tried every cream and moisturizer, and the dryness keeps coming back, it might be worth looking deeper. Sign 6. Muscle spasms and weakness. Cramps that appear without warning, muscles that lock up, weakness in the legs or arms, no obvious explanation. These are classic signs of vitamin D deficiency, and they directly impact quality of life. Vitamin D plays an essential role in neuromuscular function. It regulates calcium channels within muscle fibers. These are the mechanisms responsible for contraction and relaxation. When levels fall, that regulation breaks down. Muscles contract involuntarily. They can't relax properly. The result is pain, stiffness, weakness. Many people accept this as just getting older, but it's not. And it's not just discomfort. The weakness can be significant. Getting up from a chair feels harder than it should. Climbing stairs requires more effort. Activities that were effortless a year ago now feel like a physical challenge. Many people attribute this to age, to being out of shape, or to not sleeping well enough. Rarely does anyone consider that muscle cells may simply lack the vitamin they need to fire correctly. There's also a connection that surprised researchers for decades. People at higher latitudes have less sun exposure, they have lower vitamin D levels, and they have significantly higher rates of multiple sclerosis, a disease that causes inflammation and nerve damage in the brain and spinal cord. The link was first identified in 1976. Multiple studies since then have confirmed it consistently. You're halfway through the video. Tell me in the comments, which of these signs have you experienced without realizing it could be related to vitamin D? I read everything. Sign 7. Brittle hair and hair loss. Your hair is falling out, or breaking, or just looks wrong. Thin, dull, lifeless. Before you blame genetics or your shampoo, consider this. Vitamin D stimulates hair follicles. These are the structures responsible for hair growth. When levels drop, follicles enter a resting phase too early. They produce thinner strands, weaker ones, strands that break before they should. A study in the Journal of Cosmetic Dermatology found something striking. Women with low vitamin D levels experienced greater hair loss, brittle nails, and reduced keratin, the structural protein that makes up both hair and nails. In more severe cases, vitamin D deficiency can contribute to alopecia areata, an autoimmune condition. It causes patchy, unpredictable hair loss. Here's the frustrating part. Most people spend months and significant monies on hair treatments, oils, supplements, specialized shampoos, while the actual cause goes unaddressed. Diffuse hair loss across the entire scalp, not localized to one spot, combined with other symptoms on. This list is a signal worth taking seriously. A vitamin D test costs far less than most hair treatments, and it addresses the root, not just the symptom. Sign 8. Impaired vision. This one surprises almost everyone. Most people never connect vision problems to a vitamin, but the evidence is growing, and it's harder to ignore every year. Vitamin D has receptors in the tissues of the eyes, including the retina and cornea. Adequate levels are necessary for corneal health and for the eye's ability to adapt to lighting changes. When levels drop, pupils may struggle to adjust to darkness. The eyes become more sensitive to bright light. Night vision becomes unreliable. Driving at night feels harder. Bright screens feel more irritating. These changes tend to develop gradually, which is exactly why they get dismissed as normal aging. There's also a more serious concern. Recent research shows an association between low vitamin D and a higher risk of age-related macular degeneration, the leading cause of blindness in people over 60. One study found that people with vitamin D deficiency had nearly twice the odds of experiencing visual impairment. Vitamin D doesn't cure vision problems, but maintaining adequate levels throughout life appears to be a form of protection that most people never consider, and most eye doctors never mention. Sign 9. Mouth ulcers and canker sores, they keep coming back. One heals, another appears over and over. If you maintain good oral hygiene and still deal with frequent canker sores, the problem may not be in your mouth, it may be in your blood. Vitamin D modulates the local immune response in the oral cavity. People with this deficiency have lower levels of antimicrobial peptides in saliva. These are natural substances. They protect the mucosa from infectious agents. When those levels drop, the mucosa becomes vulnerable. Small traumas that would heal quickly in someone with adequate vitamin D turn into recurring ulcers. They disrupt eating, talking, sleep. Asking your doctor for a vitamin D test alongside your next dental checkup is a simple step, low cost, and it can break this cycle entirely. Sign 10. Bleeding gums. Gums that bleed when you brush or floss, or sometimes for no reason at all. Most people blame technique, or their toothbrush. But vitamin D plays a direct role in gum health. Almost nobody talks about this. Vitamin D has anti-inflammatory properties in gum tissue. It helps produce cathelicidins. These are antimicrobial compounds. They protect against pathogenic bacteria. When levels fall, gum inflammation becomes harder to control. The local immune response weakens. Gingivitis and periodontitis become more likely. There's also an indirect path. Vitamin D deficiency impairs calcium absorption, and over time that weakens the alveolar bone, the bone that supports your teeth. When that bone loses density, the teeth become less stable, the gums become more exposed, and infection becomes easier to establish. If you've reached this point and identified 3 or more of these signs, what comes next is even more important. These last 4 signs are the ones doctors are slowest to connect to vitamin D, and the ones that cause the most diagnostic confusion. These are the signs that go undetected for years, the ones that get misdiagnosed as aging, as stress, as separate unrelated conditions. Pay close attention. Block 2. The signs almost nobody links to vitamin D. Sign 11. Sleep disorders. You can't fall asleep, or you wake up at 3 a.m. and lie there for hours, or you sleep a full night and feel like you didn't sleep at all. Most people try everything: no screens before bed, meditation, melatonin supplements, chamomile tea, and nothing works. Here's what they haven't checked. Vitamin D has specific receptors in the sleep-regulating areas of the brain, including the suprachiasmatic nucleus, the body's internal clock. It's also involved in melatonin regulation, the hormone that signals the body it's time to rest. When vitamin D levels are low, that entire system can break down. Sleep becomes fragmented. Falling asleep takes longer. Quality drops even when quantity seems adequate. A systematic review in the journal Nutrients analyzed 9 studies on the relationship between vitamin D and sleep. The finding was consistent. Vitamin D deficiency is associated with a significantly higher prevalence of sleep disorders, including sleep apnea and restless leg syndrome. A clinical trial showed that supplementation improved sleep quality measurably. It reduced the time to fall asleep and decreased nighttime awakenings. Think about what poor sleep costs you over months. The fatigue, the brain fog, the mood instability, the reduced immune function, all of it compounding, all of it potentially tracing back to one correctable deficiency. If you've fixed everything else and still can't sleep, check your vitamin D before reaching for medication. Sign 12. Slow wound healing. A cut that should close in days, still open after 2 weeks, maybe 3. A minor scrape that gets infected before it heals. A surgical site that stays sensitive far longer than expected. These aren't random bad luck. They may be signs that vitamin D is critically low, and the body has lost the resources it needs to repair itself properly. Vitamin D controls the production of compounds essential for skin repair after injury, including growth factors that coordinate cell migration to the wound site. It also regulates the local inflammatory response. That response needs to be activated to start healing, but it also needs to be controlled, or it prolongs the process and causes further damage rather than repair. A 2019 review found that vitamin D deficiency compromised specific aspects of wound healing in dental surgery patients. A study of 221 patients confirmed this. Those with severe deficiency had significantly higher inflammatory markers, which can delay and complicate healing of any wound. From the simplest to the most complex, pay attention to the small things. A wound on your skin that's been there for weeks without improvement is not something to wait out. It's a signal that something deeper may be wrong. If you've reached this point and identified 3 or more of these signs, what comes next is even more important. These last 2 signs are the most unexpected and the most often misdiagnosed. Sign 13. Difficulty losing weight. You're eating right, you're exercising. The scale doesn't move. This is the sign that surprises people the most. Nobody thinks of vitamin D when weight loss stalls, but there are strong biological reasons it should be on the list. Vitamin D is stored primarily in body fat. The higher your body fat percentage, the more vitamin D gets trapped in that tissue. and the less circulates in the blood. This creates a cycle that's hard to break. Excess weight lowers available vitamin D, and low vitamin D makes losing weight harder. The mechanism runs through at least 3 pathways. First, vitamin D regulates leptin, the hormone that signals satiety. Low vitamin D means that signal weakens. You eat more than necessary without feeling it. Second, it influences calcium metabolism inside fat cells. When vitamin D and calcium levels are adequate, the body tends to burn fat rather than store it. Third, and this one surprises most people, vitamin D influences testosterone and other anabolic hormones. Low vitamin D means lower testosterone. Lower testosterone means less muscle mass, a slower resting metabolism, and fat loss that becomes progressively more resistant to effort. What makes this particularly frustrating is the invisibility of the obstacle. You're doing the right things, you're putting in the work, but the biology is working against you in a way no amount of willpower can override. Correcting the deficiency doesn't make weight loss effortless, but it removes a significant barrier, one that may have been quietly blocking progress the entire time. If you've done everything right and the weight still won't move, a vitamin D test might reveal the obstacle that no diet alone can fix. Sign 14. Chronic lower back pain. It's always there. Some days worse, some days manageable, but always there. Lower back pain is one of the most common health complaints in the world and one of the most frequently misattributed. People try physical therapy, painkillers, posture corrections, new mattresses, and yet the pain persists. The connection to vitamin D is stronger than most clinicians acknowledge, and it runs through multiple pathways simultaneously. A systematic review and meta-analysis published in Pain Physician analyzed 81 observational studies. The conclusion was consistent. Vitamin D deficiency is significantly associated with chronic lower back pain. The mechanisms are multiple: weakening of the vertebral bones, inflammation in the tissues surrounding the spine, compromised function of the paraspinal muscles. These are the muscles that hold the spine upright, and demineralization of the intervertebral discs. There's also a neurological dimension. Vitamin D modulates pain perception through receptors in the central nervous system. People with low vitamin D may have lower pain thresholds. They feel the same structural condition as more intense pain than someone with adequate levels. The same spine, different vitamin D, completely different experience of pain. This means two people with identical MRI results can have radically different pain levels. The difference may come down to something as simple as a correctable vitamin deficiency. That's not a minor detail. That's the kind of information that can change the direction of someone's treatment entirely. If you've lived with chronic lower back pain and never checked your vitamin D, now is the time. Block 3. What to do now. Causes and risk groups. Understanding the signs matters, but knowing why the deficiency happens is what lets you actually fix it. The most common cause is simple: not enough sun. People living at latitudes above 40 degrees north or south face significantly higher risk. The sun stays too low for months. It can't trigger adequate vitamin D synthesis. But even in sunny countries, deficiency is surprisingly common. People spend their days indoors. They wear sunscreen constantly. They don't get sun at the right times or for long enough. And here's something that catches most people off guard. Even when you do get sun, the window is narrow. The UVB rays needed for vitamin D synthesis only reach Earth's surface at a certain angle. Early morning and late afternoon sun, the kind most people get while commuting or walking the dog, often doesn't cut it. Midday sun, even for 15 to 20 minutes, is far more effective. But that's also the sun most people actively avoid. Other high-risk groups include people with darker skin. Higher melanin reduces synthesis. Older adults, skin efficiency drops significantly after 50. People with obesity, vitamin D gets trapped in fat, tissue, and people with conditions that impair intestinal absorption, like Crohn's disease, celiac disease, or severe irritable bowel syndrome. Food sources exist but are limited. Fatty fish like salmon, trout, and tuna, egg yolks, cheese, certain mushrooms exposed to sunlight, fortified milk and cereals contribute, but they rarely correct an established deficiency on their own. How to confirm and how to act. One blood test, that's all it takes. The 25-hydroxyvitamin D test, called 25-OHD, gives you the number. Below 20 ng/ml is deficiency, between 21 and 29 insufficiency, above 30 adequate for most adults. Some functional medicine practitioners aim for 40 to 60 ng/ml for optimal health, but that range should always be discussed with your doctor. If you identified 3 or more signs in this video, don't wait for symptoms to worsen. Request the test. Bring this information to your doctor. Don't accept "it's just tiredness" or "it's your age" without checking what the numbers actually say. Supplementation, when recommended based on test results, is safe and effective. It works, often faster than people expect, especially for energy, mood, and sleep. Most people notice a difference within weeks of correcting a genuine deficiency. But dose and duration need to be guided by results, not guesswork. Too much vitamin D can cause problems of its own, so the test isn't just a starting point, it's a guide throughout. You now know the 14 signs. If 3 or more resonated while you were watching, act on it. The test is simple, the information is powerful, and catching this early changes everything. If this video was helpful, like it, share it with someone who needs to see this, and subscribe for more content like this. Thank you for watching. Take care of yourself.